reading Curtis Prout, MD, morale doctor. The only part of my body Dr. Prout ever touched was my ears. He pierced them rapidly, quoting Blake, "Neither mortal nor hand nor eye can frame thy fearful symmetry." He made me laugh and also made me feel that before long I would be a young woman back out in the world, maybe even dating again. 2 months before the ear piercing, in January 1967, when I arrived at Stillman Infirmary, Harvard University, he was one of the many doctors and other staff who came to assess my condition. He was the only one who actually eased his middle-aged, tall, 6'5" frame into an armchair and talked with me casually for 15 minutes or so. I had just been transferred from Misericordia Hospital in the Bronx after a T11-L1 spinal cord injury in an October car accident, followed by emergency laminectomy and fusion. Until early January, I had been in a full body cast, 25 pounds worth. Now I wore a tailor brace with a night extension, complete with pink garters, though I was not yet walking. At least I could finally wipe myself. Stillman and its staff were wonderful. At that time, the infirmary had a full-service inpatient unit where sometimes students were transferred direct from hospital recovery rooms. The head of physical therapy, who usually dealt with more minor ambulatory conditions, arranged his schedule to spend 3 or 4 hours with me daily. If I needed something, the one electric hospital bed on the unit, for example, it appeared. It also felt luxurious. The food was good. Nobody seemed to limit the number of visitors I had or how long they stayed. I was awakened daily not by vitals and crashing bed panels, but by an aide quietly opening the curtains sometime after 7 a.m. Even in that setting, Dr. Prout was special. I began to think of him as my morale doctor, though I don't think I ever said it out loud. The move from the Bronx to Cambridge had been largely for my morale, at least as I saw it. A week earlier, the Misericordia doctors had said that I could start getting upright, then walking. A senior radiologist reviewed my x-rays and decided no, not for a few more weeks. My mood was lower than any time since the accident, although I kept at my physical therapy. Long before the internet and cell phones, my mother managed to get the chief Misericordia neurologist, the chief Misericordia neurosurgical resident on the line with the surgeon who headed orthopedics at both Mass General and Stillman. The latter convinced the former that I would get all the rehab I needed in the infirmary. We hoped that a new evaluation would let me get on my feet sooner. It was also vitally important to me to see my friends from my Harvard Radcliffe class of '67 often, because the infirmary was right in the middle of the square. A few days later, my mother and I were whisked north by ambulance at a speed that might have caused another accident. I don't think Dr. Prout, who was the medical director of the infirmary, said he was there, why he was there, other than to greet me on my first day. But I was impressed by his sitting down, how relaxed he seemed, that he stayed a while talking with me. Not that I remember what we talked about. He began to come every day, letting me know ahead of time when he would not be able to. Before long, he told me that while in college he had been hospitalized for 4 months with osteomyelitis of the skull, which left a deep scar, a vertical furrow running down the middle of his forehead. As a result, he had gone into medicine, primary care, and had a particular interest in young people enduring lengthy hospitalization. On his daily visit, he sat and talked with me about whatever I wanted. He became very important to me, not quite a transference relationship, but headed that direction. Although Dr. Prout wasn't a psychiatrist, he certainly was the person I discussed all kinds of things with, including my changed relationships with family and friends, and of course, what it was like to be inside a total institution, 2 of them, for so long, 6 months. Finally, sometimes we just joked around. I wasn't wasn't ready to acknowledge that I would never be my former normal self again, but he would have been open to talking about that too. I once went into a panic when a nurse mentioned a scar on my back that hadn't previously been described to me. I was sure my repaired spine was coming apart. The nursing station called Dr. Prout, who came right away. He talked me through it, calmed me down. After I was trudging along, he took me to visit another of his patients, a graduate student with lupus. The minute I four-point gated into her room, I felt I shouldn't be there because she was very ill and likely to have many relapses over her lifetime. At that time, I planned to eventually walk full speed, so our situation seemed very different beyond the fact of our long hospitalizations. Looking back, I realized because I never did walk normally again and have had increasing disability as I've gotten older, maybe Dr. Prout realized our long-term similarity more than I did. The main thing I remember about talking with him was the feeling of comfort and acknowledgement, of still being a whole person despite the trauma I had been and was still going through. Excited as I was to leave Stillman in April, it was emotionally very complicated, going from the protected environment of the infirmary to the socially and physically demanding one of dorm and classes. Sometimes I even wanted to return for a night or two, just to relax and reduce the number of decisions I had to make, the amount of stimulation a day included. During this period, I visited Dr. Prout a few times in his office, mostly to feel his understanding and acceptance of me as I tenuously began to re-enter college life. Then I got myself more or less adapted and never saw him again, no longer needed him. I'm not sure I ever thanked him, though he lived till his mid-90s. I am sure I never told him that he was my morale doctor. It strikes me now that he probably knew. Many mornings I think of Dr. Prout when I put on my earrings and go out to meet the day.